talking. Okay. Welcome. Start. Okay, everybody. I am Dr. Burns. You probably know that if you're watching this tonight. And I'm going to preface this going, if any of you worked with me in the field, I tend to be a digital nightmare with technology. So this is a huge challenge, but I'm really excited that we are able to bring to you what would be our 15th year of the spring seminar. And I will preface this saying this would never have been possible without our office manager, Margie Black, who has been instrumental, as she has every year, in pulling this off. And as a preface to the meeting here, I will tell you there probably will be a few hiccups, but please bear with us. Even if the screen goes black, we'll try to be back. And yeah, this hopefully will be fun. What I want to say in the beginning here is I don't want you to forget that this is just the first in a series of 3 more webinars, and you'll be able to hear from 3 of our other great doctors, Dr. Ashley Slater, Dr. Tess Tucker, and Dr. Christian Stoll. And that'll be in the following weeks, and I'm sure you have that information. There's a little bit of housekeeping that I would like you to be aware of. As I am struggling myself here a little with all the technology, if you look at your screen, there's a cursor that you should be able to bring up on the bottom. And there are 3 icons: chat, raise your hand, and Q&A. If you can see that, if you hit raise your hand, then why don't you just go ahead and see if that works for you, and we'll know if it's actually working. All right, I'm really impressed. Yeah, I see numbers coming up here. Number of participants are raising their hand. So you guys are actually better at this than I am. That's great. Now, I'm going to just move to the next icons we talked about. For the Q&A box, this will be what we're going to address at the end of the webinar. Just like we did in the other seminars live, we won't be answering questions during the webinar, but we will come together, myself and the other doctors here that are part of this, to answer all the questions following about a half-hour, 35-minute presentation, if I can get through this. But during the webinar, you can type Q&A, and then you can submit that. And at the end, we will review the questions and we will work our way through. If we don't get through all the questions, I promise you we will contact you, or we will post answers to try to get everybody's concerns addressed. And finally, there is a chat icon. Now, that chat icon is one that will be active in the seminar, but it is one that is your ability to interact with the panelists or the other doctors. I will not be a part of that directly because I'll be trying to get through the presentation. And we'd like you to refrain from using it. What it's really for during the presentation is if your screen goes black or if something isn't working for you, maybe, or for us, they can let you know what's going on or try to help you with that. So those are the 3 icons that you all have. There also will be a polling icon, which will allow you to interact during the video. That will pop up on your screen. And when that appears, there'll be a little question. It's a way to get everybody involved, if I can get it to work. So anyway, I think this is a little different. Normally I look at you all and I'm looking at myself, which is a little awkward. But I think I'm going to try to start this with you, and we'll go through my presentation, which is Tick-Borne disease. And I'm excited to get this out to you. And like I said, we will interact personally at the end of the presentation. So now, with a little help from my office manager, I am going to navigate. And we will get this to come up for you guys. And just bear with me one moment here. I was going to try to have this a little more professional, but there we go. Now we are starting our presentation. Should I be in the corner or am I not? Don't worry about it. Okay. All right. So now let me try to get through this. Okay. Tick-borne diseases, prevalence and prevention. All right. So we've got a lot of information here and I'm going to just jump right into it right now. So here we go. Okay. I love this slide. And this is a good starter. The terrorizingly, tremendously tricky ticks. Ticks really are little creepy characters that could be the main player in any horror flick, which, you know, that just kind of makes them exciting, but it also makes them terrifying. What I mean is that these little guys, to begin with, when you get up close or under a microscope, they really are scary. They're not pretty. They have claws and sucking and chomping parts, and they like to hide out in dark, often damp places, like the deep woods or tall grasses. And then they like to attack their victims, your horse or us people, and do so without anybody being aware, and then inject us with potentially lethal pathogens. So yeah, these guys are scary. And that's why I want to spend a little time here with you today to talk about it. There are actually 900 tick species we know of worldwide, of which 35 are in North America alone. Ticks transmit more diseases than any other blood-feeding arthropod in the world. And one tick, you know, they can transmit bacterial, viral, rickettsial, protozoan, and nematode, basically any infectious agent ticks can pick up and give to some unfortunate individual or horse. There's estimated that some ticks can carry, one tick alone could have 40 different pathogens. So that's amazing and scary. And ticks are the primary vector of most diseases now causing agents both in humans and companion animals and wildlife. No other vector is capable of passing on to others as many different diseases. So basically, there's really no such thing as a safe tick. And to make this even a little more exciting story, we really are sitting on a ticking bomb. And what I mean by that is going forward here, right now, basically that in all 50 states, there are now tick-borne diseases. And this slide actually represents the human prevalence. And if it's black, that's what's important here to look at, is the darker the color, the more intense the infestation of ticks and tick-borne diseases. And the human prevalence parallels the equine. And in this scenario, what I want you to realize is Wisconsin is actually black, and you may all be aware of this. And so what I'd like you to see here is that actually Wisconsin, when you break it down, is in the top 5 this year in 2020 when it was reviewed. And so I'd like to just quickly see if I can take a poll here. And this was one I was supposed to do before we started, but why not do it now? Because I think this would help me right now. Is since we're all at home and nobody's driving, what are we drinking tonight? So this is just for you to fun and try to work out the polls. And I got to share this with you and launch it. So now you can see it. And again, this could have been a little smoother. But we're asking you to, just for fun, and man, you guys are smart. You're able to do this. I was going to launch this poll in the beginning, but you know, I really wish I could participate in it right now, and you guys are really jumping in on it. It's perfect. And so, yeah, that's good. You know, I appreciate you taking the nerve here to jump in and respond. And I see that we have a nice spread here, anything from water, which is what I'm drinking, and coffee. And so I'm going to share the results. And yep, the results are water is winning. And I did share. Okay. And so anyway, again, I'm getting a little help here, but this is good for me and for you guys. And I appreciate you jumping in and participating. And so anyway, that was kind of fun. So now I'm going to stop sharing these results. And I actually want to launch another poll that I was going to have here to get some participation. Except now the same poll came up. Okay, this is what I'm got to figure out here. I might have to ask my office manager. Let's see here. No. He wants polling. I don't want to do that. Okay, you know what? I'm going to keep going here so that we can get through the material. And I apologize for a little blip here. All right. So as we go forward, let's move forward here. So how do we help ticks? Okay, so this is the question is, why are we on a ticking bomb? Okay, so the reason is threefold that we can start with. One is climate change. And we know that climate change is having an effect on a lot of factors, but it's also unfortunately favoring ticks. And what I want you to look at here is, I can let you look at this here. So if you see this little laser pointer, this map of the US here, and you don't have to read, maybe you can read the print, but it's from 1970, and this is 2016 to the right. What I really want you to see is the darkest area refers to temperatures in January that reached -10 degrees. And you can see in about 46 years, this line has creeped quite a ways further north. So that's indicative of climate change. And even this last winter, for as much of a winter as we've had, I think we all realize that if you think back to this January in southern Wisconsin, we really weren't -10 degrees. So what does that mean? Well, this is great for ticks. They are rapidly expanding. And the other side of this is more moisture that many areas are receiving also favors ticks. So it's not good. This is why we're on the ticking bomb. The second thing here is mobility. Of course, COVID has slowed us down, but in general, horses as well as people are moving constantly. Even whether it's just local from state to state or international. And at this time, it's a real threat because, an example that I don't have to go over is COVID. It's a pandemic that mobility has played a major role in, and it's no different for horses with tick-borne diseases. Finally, development. Development is also a huge factor now as more and more people are, here, and they are moving out into more rural, into more undeveloped areas, more vegetation. This is ideal contact for their pets and their animals, their horses, to come in contact with ticks and the diseases they carry. Now, along with that is the fact that many of the creatures that live in these more wild areas are adapting to human involvement. So what we're seeing now, for instance, is the white-tailed deer populations are booming, and so are mice. And these are all intermediate hosts of which support a rapid increase in tick population. So the whole story ends up being not so good for the outcome here for us. Okay, so what's the other part of it is, how do ticks help themselves? Well, ticks have been around for at least 90 million years, and put that in perspective, as people, we've only been here 200,000 years as we are as humans. And if we go back to our early ancestors, we only been around 6 million years. So ticks have been here long before us, and I guarantee you they will be here long after. So they're tough. And some species of ticks can go into a hypobiosis for up to 2 years and survive, and still, become active and spread disease. Some species of ticks, including the deer tick, which is the main concern for us here, basically have antifreeze in their blood, and that allows them to survive the extreme temperatures that we have here in the Midwest. Ticks are showing their adaptability, like I talked about, to develop new host relationships as they expand their ranges. There is a winter tick that only attacks wildlife and horses when temps are below freezing. And actually, one of the main predators of this tick, to give you its potency, are moose. And they have wiped out moose populations, like in northern here in Wisconsin on the what's the island right off the coast here that has a moose population of Lake Superior, Island Royal. And so just to give you an idea of the power of ticks, and the deer tick is the primary vector of multiple diseases, is active year-round, and becomes active when temps rise above 40 degrees Fahrenheit. So that would be actually right now. So the current distribution of ticks. So this slide, and again, a lot of these slides, I apologize, it's a lot of information and I don't want you to get bogged down in it because we're covering a lot here. I want you to kind of focus on where Wisconsin lies, and there's like 6 ticks here on the screen. However, I actually left 2 more out that are of concern in Wisconsin, but primarily on this screen, the black-legged tick is a concern, and so is the dermacentor or the dog tick. And those 2 ticks affect horses as well as humans. We also have the spinnose tick, which is an ear tick that can be a menace to the horse. And we also have a new arrival is the Lone Star tick, which can, in horses, pass, can spread anaplasmosis, but it also can do some other scary things. And I'm going to see here if I can launch one of my polls. I'm going to have to ask some help here. Let's see here. Here we go. Let's try this question here. Okay, so what of these ticks is responsible? I'm going to launch this poll because what I'm talking about is a new disease called alpha-gal. And it's a syndrome that causes a food allergy to red meat and products made by mammals. So the 3 ticks that I'm concerned about here in the Midwest primarily are the Lone Star, the American dog tick, and the black-legged tick. So for those of you who want to just jump in for fun, if you have an idea which tick might be involved, just give it a go. This is just for fun. I don't expect everybody to know. It's just kind of a fun thing because it's actually a scary thing. I mean, if you do eat meat or have steaks, what an awful thing to do to have a steak and then possibly die. So good, we're getting good participation here. And all right, I'm going to end the polling here and I'm going to share the results. And you know what? We're kind of neck and neck here with the black-legged tick and the Lone Star tick. Well, it's been proven that actually the Lone Star tick, and that's the knowledge that I have. And you know what? With a lot of these tick questions or tick information, we're learning more all the time. But right now, the Lone Star tick is the primary tick involved, or the only tick that I know that can cause this allergy. And it's actually a sensitivity to the saliva of the tick itself that is close to the proteins that are in red meat. So yeah, that would not be fun. So I'm gonna go on here, and I appreciate you jumping in and going with that one. And we'll keep moving through the slides here. So here are those 3 ticks we just were kind of highlighting. And again, the spinnose tick is not as big a player, but that's one that if you get an ear infestation, horses can, or people or dogs or anything, can be driven nuts, rubbing their ears raw. But here's our 3 main players in the Midwest, with the Lone Star being a new arrival. So here's another challenge. And again, it's a lot of information, but I just want to highlight here. Look how small we're talking. Here's a dime, and there's the D in the dime. That's the size of a tick larva. Here's the size of a nymph. And in my next slide, you're going to realize that actually probably 80% or more of your risk is from just these 2 phases of the life cycle of a tick. So this is not an easy character to find on your body, let alone your horse. So we'll continue here. And briefly, again, a lot of information, but what I wanted to highlight here again is, and this is for Ixodes, the black-legged deer tick, which is our primary tick of concern here in Wisconsin with horses and people, to be honest. And as you can see, the adults really only have a small time here. Otherwise, the rest of the time, they lay their eggs the first spring. Up here, those eggs develop into the larva. They're after a full year almost, they evolve into the next spring into the nymphal stages, which then come all the way around until they develop into the adults, which then just have basically a end of summer, fall, where they lay their eggs, which then start the whole 2-year cycle over. So just it's a lot of information, but they are fascinating creatures, and the more we understand about it, I think the better we'll be. All right, so let's jump into what we're concerned about here. What are the 3 primary diseases? And before we get into this, I'm going to see if I can launch a poll here and do this properly here. And let's see if I got it right. Okay. So of the 3 diseases, I'm going to launch this now. I'm getting a little better at this maybe. So of the 3 diseases below, which we're going to be talking about, which are Lyme, Anaplasmosis, Piroplasmosis, which does not affect humans. And you guys can just jump in here, anybody who wants to get involved. And again, I just appreciate that it's a chance for us to all have a little interaction in a situation that's a little different here with the webinar. And all right, I'm just going to carry on and I'm going to end the polling. I appreciate everybody that jumped in, and I'm going to share the results. And all right, you know what? You guys are pretty smart. It's Piroplasmosis is the right answer. People can get anaplasmosis. So, and of course, everybody here unfortunately knows that Lyme disease is a threat to both you and your horse. All right, so thanks again. I'm going to get this off the screen and we're going to carry on here. So here, this slide is, anyways, kind of fun, but what it shows here is, yeah, horses that are terrorized. And yeah, it is a little scary what they're up against as we are ourselves. So I'm going to carry on here. Let's start with anaplasm. Okay, again, a lot of information. So what we're going to go over here is Anaplasmosis phagocytorum, formerly Ehrlichia equi. It's an obligate intracellular gram-negative bacteria. It has a wide variety of intermediate hosts, which include the human, which is why we get the disease. We're dead-end hosts, which means we're not really capable to pass this on. It's most common in late fall to early spring. Most common in younger horses, and the presentation is less severe in horses under 4 years of age. Incubation is anywhere from 8 to 14 days, but up to 45 days. And something I want you to really be aware of here is we have found with testing now, and no surprise when I had that statement earlier that 40 pathogens can be in one tick, that many ticks that have given your horse anaplasm have also given them Lyme disease. So that just makes things even more serious. So what are the signs of anaplasm? Well, basically, quite a bit here, a sick horse. Fever can be as high as 104, depression, anorexia, no eating, edema, swelling of the limbs and chest is very characteristic in many individuals. Petechia and the mucous membranes, and actually neurologic deficits can present. How do we diagnose and treat? Well, it attacks the red cells, and so we will see low platelet, white, and red blood cell counts. Inclusion bodies, which this slide demonstrates right here, actually can show the intracellular organism in a white cell, which we can actually see on a slide. Other ways, the PCR is our most definitive test that we normally run. The good news with anaplasm is that when you treat with Oxytet, it has a really good outcome typically if we get to it soon enough. 10 days to 2 weeks, you can start with IV. That's the preferred, the hit it hard early, and then switch to an oral doxycycline. Small percentage of horses will relapse 3 weeks post-treatment, and infection can be self-limiting and impart immunity for several years. Okay, we're going to jump into Lyme disease. So this is one that we could probably spend hours on. And I know it's a concern probably to everybody watching this tonight, and I'm going to try to get through this. So Lyme disease, the primary player that we're aware of is Borrelia burgdorferi. It's a spirochete organism. It's been around, as we already said, a long time. The disease first was identified in humans in 1976 in Lyme, Connecticut, hence the name. The Midwest and Northeast are the hotbeds, as we saw in the previous slides, of even the tick problems. It mimics that. It's endemic to our area, and it's increasing. The prevalence now is up to 50% of all ticks tested are positive. Current estimates are, and this slide, I actually got an update today on Common Research that they were estimating just a year or two ago 300,000. Now it's 475,000 Lyme cases in the US yearly, and 85,000 to 100,000 in Europe at least. And in new strains, this is the challenge of Lyme are being discovered. One of the recent ones is Borrelia mayoni, the evildoer. I kind of like that name. Basically, there's more questions than answers. And I know just from some research in the last year or two that I know there's at least 6 more, strains of Lyme that we found. And so, yeah, it's a moving target. And here's the tough biology. Why is Lyme such a tough disease for us? Well, it can move from the tick to the host in under 24 hours, and now in people it's been documented as quickly as 8 hours. Borrelia has developed highly evasive tactics. It's very good at getting around our immune system. It can shapeshift. It can change its form from spirochete, cysts, granules. These all provide protection depending on the environmental conditions that it is up against. When it's exposed to antibodies, starvation, pH changes, it has a defensive biofilm, which makes it difficult for the antibodies of your immune system to even recognize it and reach it. Borrelia can become dormant, and in this state reemerge when conditions are favorable. So the immune system may kind of go to sleep. You're stressed, your horse is stressed, and years later, the disease can flare. And it can change its surface antigens, which now we have developed a test, which is our primary way of defining it. But just not to get bogged down in this, but basically there's OPS-A, OPS-C, OPS-F. These are little proteins. And the crazy thing is this organism starts with OPS-A in the tick, and then it can shift to OPS-C within days within your body, so that what the original recognition is, now it's something different. And then as the immune system tries to catch up, within 3 to 11 weeks, it can switch to OPS-F, which is a chronic form that can be present for years. So this variability makes it just difficult on every level for us to both treat it and know our effectiveness of treatment. Signs of Lyme disease, well, basically, it can be pretty much anything. It can be vague, lethargy, low-grade fevers, chronic weight loss, behavioral changes. Neuroborreliosis is a fancy name for neurologic changes, uveitis, shifting leg lameness and stiffness, arthritis. And the long-term concerns with older and immunocompromised horses that may have had the disease for years and now start to show signs, especially with our geriatric population now, which is great. They're living longer, but we're seeing some with more difficult complications to treat from Lyme. The diagnosis of Lyme disease. So it's a challenge, but patient testing is based on antibody titers instead of the actual organism or PCR. And the reason, again, is that that organism can hide out so effectively in the body that to recover it for actual PCR testing can be tricky. Sometimes we are successful with CSF or biopsying, but again, on a routine basis, we're pretty much using the antibody titers, which again are good information, but they have limits. The Western blot test too, but again, it's not as good at staging the infection as we have with the 3 different antigens for acute versus chronic. And there's a cool picture of those squiggly lines all over. These are actually Lyme, or these are individual spirochetes, which kind of sound like what they are. And here they are attacking a poor cell. I mean, it's not a pretty picture. All right, so the treatment and prevention of Lyme. Well, the treatment is very similar to Anaplasmosis. These guys do respond to oxytetracycline. The challenge is, when do we catch the infection? And the treatment is, you want to hit these hard for sure with an IV for 3 to 5 days, and then you follow with oxy for at least 28 days or more. And this is paralleling human treatment. It's very challenging. Even with chronic human cases, we really don't know. And unfortunately, once that Lyme organism embeds itself, we may be just trying to control resurgence and, put it into dormancy, kind of like remission to keep an animal healthy. Also, adjunct herbal options are being combined in human treatments. Controlled studies are lacking. However, recently I found that Johns Hopkins has a study out that skullcap, devil's claw are two herbs that are successful in treating Lyme disease, and they've actually been shown that they may parallel, be as effective as treating early infections with tetracycline. So, I think as we learn more, again, horses, we haven't done as much research, but I would guess there's some benefits. So I think this is where, alternative and regimented treatments that we know work are worth, considering. The ultimate outcome is variable due to the complexity of the disease. Prevention. Vaccination is a hopeful and useful adjunct that we are using more of, but it has limitations that I want to just quickly go over. It's an off-label use of a canine vaccine. One of the big challenges we're finding with the horse is that protection is only for a maximum of 6 months, and in many individuals is 4 months. So with year-round exposure to ticks, you've got to be vigilant if you're going to vaccinate your horse and keep them protected. But we do have horses in the practice that I think have had a positive response to the at least twice-a-year vaccine, but it is a commitment. And but I am recommending it if it's in your means. Again, one of the big things is just knowing your horse, monitoring your horse, and tick control, which I'm going to get into here shortly. Piroplasmosis, and I apologize, I'm covering a lot here quickly because I know I don't want to keep you guys up all night with this, but and I do want to briefly say that this will be recorded. So this is something, if you didn't catch it all or you're interested, you can look at these slides, and you can always call and ask questions later if it's a little overload. So, all right, so here we go. Piroplasmosis. So what do I want to show you here? Basically, this slide, I don't expect you to, nobody can read those colors, but what's important here is this is a worldwide disease. The yellow is endemic. So a good part of the world, this means that horses here are living with this and ungulates that it attacks year round. It's in the population. The green, like here in South America, Mexico, and in northern Russia, those are areas with hotspots that have continuous isolated areas where the disease is always present. The good news is these kind of red or purple areas are actually considered piroplasmosis free. So that's including the United States, but that doesn't mean that it hasn't been here. And I'm going to go forward here so I can explain that a little further. So to begin with, piroplasmosis is an obligate intracellular parasite. But again, maybe what I should do, I'm jumping around here. We just talked about the worldwide spread, but this map here of the US, what I want you to look at, and you don't have to spend a lot of time, but this is showing that from 2009 to the present, that there has been repeatedly piroplasmosis getting into the United States, hitting horse populations. One to highlight is actually 2009, Texas is red, because of like over 400 horses on one ranch ended up being positive for piroplasmosis. And again, this really directs much going to mobility again. Horses are being transported, and you bring a horse in, it could happen, and it has happened in Wisconsin. You can see here, it could happen in Lake Geneva, and you bring an animal in that isn't tested, it can spread this disease. And this disease is a serious disease. And I'm going to just kind of run through this. I'm not worried about zebras, but we do have donkeys. It was first documented in Florida in 1961. And like I said here, there's been continual concern, and it continues to be a problem. I'm not going to spend a lot of time here on the life cycle because it's a lot of information. But what I want to highlight is that it has 50% mortality. This is not a disease that we want to get in the United States. If you can imagine half the horse population dying, this is a very serious disease. And we're going to go over a little bit more of this here, but just shows the importance of A, what ticks can bring to us, and B, what we have to do to try to prevent that. And so the clinical signs, basically there's 4 apparent ways that this disease presents. The acute, and I don't need to read through this, you guys can, but basically any kind of symptom can present. And basically they're pretty severe. Fulminant just means that unfortunately these are animals that you may look at one night and think they're fine and the next day they're dead. Or neonatal foals that are born and within days or hours are down and dying. And what's happening here is the primary way this disease attacks is it destroys the red cells. So these animals go into a crisis of a hemolytic anemia, and basically, if you don't have red cells, you don't get oxygen, your body dies. Now there's the chronic with non-specific signs. We can only imagine chronic anemias, weakened animals that succumb. And then here's the real problem, the inapparent carrier, reservoirs for transmission. And again, with some of these diseases, we don't understand how this is possible. Very similar to EIA or your Coggins test. There are many horses that if they got Coggins, they're going to die in a short period of time. But then there's this population, which is why we've never been able to get rid of equine infectious anemia completely, because there are those inapparent carriers. Diagnosis, well, it can be diagnosed readily. There's, if we do blood, you can see here with a Giemsa smear, it's called, these little black dots are actually the organism multiplying within red cells, which leads to their lysis and destruction. Serology, looking for the antibodies response if an animal is surviving, and PCR, which is definitive. So it is very easy to diagnose. Treatment is not so easy. Basically, our goal is once animals are sick is to try to decrease their clinical signs and fatality rates. There's T. equi and Cabela. The T. equi is more difficult, but horses infected with Babesia cabela can clear that infection after 4 years if they survive it, while with diphtheria equi, that tends to be lifelong or lead to the inapparent carrier. And the most effective treatment we have right now is imipridocard diclopropionate. It takes a 2-week course. It's not a cheap drug. It has side effects. And some horses, like I have already mentioned, are never cleared. So this is not a good thing. So now I want to get quickly and importantly, and how do we prevent the problems that we're looking at with ticks? Well, there's basically 3 general areas here: surveillance, global monitoring of equine species and transport, and controlling the vectors. And global could include local monitoring as well within the US. So controlling vectors, 3-prong attack, avoidance, premise modification, and horse treatments. And so let's get into that. Avoidance, well, that's kind of obvious, but I love this picture because this looks like where I live, my backyard in the Kettle Moraine. And it, steer clear when possible. Well, for some of us, this is home. And secondly, this is where we want to ride our horses. So it's not easy. But the take-home message is be aware. If you do go out, look for tracks that are maybe at least cut, or try to avoid those high tick areas, or do some of the other things that we're going to talk about with trying to protect your horses. Premise modification. So you can mow grasses, you can create boundaries. Most ticks, and those are the ticks I'm concerned about right now in the upper Midwest, like the Ixodes, the deer tick, or even the Dermacenter, the dog tick, they like wet, dark places. So if you have borders around your horse pastures or your yards with, even rock or, cut grass, you're going to cut way down on the ability for ticks to get into your premise or where your animals are. Controlling the hosts, the deer, mice, these are the big problems. And again, in Wisconsin, yeah, it's not easy, but those are things to consider. Don't attract deer to your yard. Don't feed deer corn in your backyard with your horses. It's not a good idea. So our outcome is we hope that the ticks look like this guy on the right if we're successful. Purchase a thermometer, surveillance. This is probably one of the most important things. And I think a lot of our clients, I know you guys are able to do this, or if you're not, you're watching your animal. And this is so important in trying to pick up on any of these diseases we've talked about, is catching them early. And if you can take your horse's temperature when they're off feed, lethargic, not acting right, if their temperature is over 102, you need to call us, or at least have a discussion. Again, if it's, 110 degrees out, well, maybe we're not so worried, but many times there's reason for concern. Horse care, removing ticks. This is important both on yourself and on your horses. Again, grooming and checking your horses daily. Hey, that's not easy for us. And, even finding it, you go back to those slides, the size of a dime, I'm sitting here with my reading glasses. But I think, we got to do the best we can. One of the key things is, getting a tick remover is a good idea, or a little pair of pliers. Do not crush ticks manually. If you grab them by the body, you basically are injecting your horse or yourself with 40 pathogens or whatever that tick was carrying directly into your bloodstream. So, if you can't get it out, you're probably better to get help than to smush it into the animals. I guess that's the message there. Horse care, protecting your horse with barriers. So I think anybody who has a horse knows there's a lot of ways to go. This poor horse here, if you can put this on your horse, man, you are very good. My horses would kill me, but that horse looks a little embarrassed, but hey, that might work. Some of these other slides here in Africa and third world countries, many of the livestock routinely are being sprayed to try to cut down on tick infestations. Years ago, this horse here was being covered in tar. I wouldn't recommend that, but that's how bad ticks have been for a long time. Here's a barrier that, there are products that just go around part of the horse, repellents. This product right here, Vector 3D, is one of the more effective topicals. And, we carry it at the clinic. You can buy 3 of these tubes. It was developed originally for small animal, but it's been effective in the horse. It has to be applied monthly and strategically, but it works. And then finally here, ultrasound. I'm not sure, but hey, if it works, I can't attest to it, but why not? If you have access to it, give it a go. Finally, monitoring. And again, this slide, I think what I want to show you here is really the middle. I'm not thinking we're all flying our horses around the world, but I still want to stress the importance of health papers. And I know we all get a little bit angry, or, I don't say angry, but it is a hassle sometimes when you're, faced with, I've got to get health papers, I've got to get, health exams. But the reality is, like I said, that disease like piroplasmosis, if one horse slipped into Wisconsin, unknown, carrying that disease with the potential for 50% mortality, we don't want to think about what that could lead to. So I think it makes sense that we're doing the best we can. And honestly, I think we're doing a good job. So I covered a lot here. I did go a little bit over. So what I would like to do now is open this up to Q&A. So if you guys have questions, if I can make this work, you'll be able to do it. I may ask for my office manager to help me here. I'm going to hit the Q&A. Okay. So at the moment, there are no open questions. What I'm going to do, though, is I'm going to stop the video. Let's see here if I can get this to work. I stopped the video, so now I'm going to stop the sharing, and hopefully you will see me here. Okay. And okay. Start the video or start my picture, and you can, here I am. All right. So at this point, let's see here. If I bring up, if there are any questions, it looks like we've got a few now coming up. And I do want you all to know now that our other doctors should be able to participate in this. And so I'm not sure, Margie, can our other doctors chime in right now before we start the questions? Are you guys there? Yeah. Okay, they look like they're muted. Maybe you guys unmute. Are you there, Dr. Slater?
Yeah, I'm here.
Yep, okay. I'm here.
There's Dr. Tucker and Kristen.
I'm here too.
Okay, great. Thanks, guys. So I'm going to just click on the question and answers here. So, all right. Okay, so here's the question for Margaret. Hi. What were the 2 herbs you mentioned? Okay, and there are more herbs, which again, because of the intensity of the material I covered, I think what I'm going to do is I will actually have us put out on our web page a list of the possible herbs, but the ones I mentioned were devil's claw, which is a common herb for a lot of horse people. It's actually an anti-inflammatory. It actually has beneficial. The other one was skullcap. And another one that I didn't mention right off the top of my head, I know, is Japanese knotweed. And what I will do is I have dosages in humans. Again, some of this is an extension, but I will put some of that information out because the Johns Hopkins study, which was in people, but I do think we can extrapolate here and, you know, it would be beneficial. So I hope that helps, Margaret. I'm going to ask you a question. If I answer live, do you have, are you all set there? I think you are. Okay, so I'm going to try to move through these. Okay, the question here is DEET harmful for horses? Well, you know what, that's one of those drugs, you could say DEET in my mind is harmful to people, but it's a balance. I think in extreme tick situations, you know, a judicial use of that may be useful. I personally, and I want to let the other panelists respond here, but DEET is used, you know, in people. I personally try to avoid some of these. I think there's limited use, but if you knew your horse was going into an extremely tick-infested area, you know, weighing the benefits of, you know, a day of DEET exposure one time, you're not swimming in it day after day, I think it might be indicated. I don't, does anybody on the panel want to respond to that?
I know it's not labeled for skin contact, and that's where my concern would be, if it would become a skin irritant.
Right. I mean, I think, and that's a good point. Sometimes it is wiped on, you know, tack or, you know, accessories. So, you know, like I said, I tend to steer away from that. I have heard some people working with it. And again, any chemical like that, you know, even pyrethrins, I've had horses that get sprayed with a over-the-counter, you know, certified spray, and they can end up with a terrible reaction. So with any of these things, even the over-the-counter, I would always recommend before you're in the midst of the season or you're going out on a week-long trip, you know, take a little and spray just a small area on your horse and observe that horse for 48, you know, hours. Make sure you don't get a rash, you get hives, because you don't want to find yourself in the middle of South Dakota and you've covered your horse and you have a you know, a significant allergic reaction. So that's an answer there. Now, if I answer these or we don't completely answer it, you can always respond back and get in line here and we can, you know, carry on. But thanks for the question. Linda, for Deb, how much do the dog vaccines cost? I'm probably the right, does anybody on the panel know the current cost? I don't want to missay. I think they're around $60 a shot. Margie?
I was going to say, I think it's somewhere between 40 and 60, but I'm not 100% sure.
How much was that?
I thought it was somewhere between 40 and 60, but I'm not 100% sure.
And actually, I think you're right about that. And I think that it is coming down a little bit now that it's getting more use. And so, yeah, so that gives you an idea. So it's not cost prohibitive. Again, like any vaccine, the first time we administer them, you've got to do it twice, 3 weeks apart. And then, like I said, to be vigilant, you really got to look at it every 6 months because probably to decide to vaccinate your horse once every 2 years, you're leaving them open for, you know, the rest of the time. And I guess I would just add briefly, the gold standard that with this would be to consider testing your horse before you would vaccinate it, because once you vaccinate a horse, you're going to stimulate the IgA, which is the primary, as I recall, antigen stimulant here, which is the first one in the three that we mentioned, because that's the one that it first enters the body from the tick to your horse. So that once you vaccinate your horse, you may always have a positive, which may leave you a little uncertain, did you get a recent infection or not? So again, we have a lot of horses that have had Lyme or have had repeated exposures that we just go ahead and vaccinate. And I'm not opposed to that, but if you want to kind of know where you're starting, you might have more information by at least doing a titer to start with. I don't know if anybody wants to add to that comment. Okay. I guess one other little thing I could throw in there, just talking to some vets I know on the East Coast where Lyme is unfortunately way as prevalent or worse even in people. A lot of people there that are treating horses will actually vaccinate horses when they become ill to try to boost those horses' immune systems. So, you know, there's, you know, we're trying everything we can. And so I do think the vaccine is a good option. It's just one whether you are willing to add that to your regimen. I guess I don't have anything else to add. And I don't know if there's any more questions. We probably run pretty long here. I guess if there are no new questions from what I see here, I'm not doing this wrong. Make sure, no, that's great. I really appreciate everybody who was able to come on tonight and, you know, watch this webinar. We put a lot of work into it. And again, I know there's been a few hiccups, but it's been fun to do. And I want to say special thanks to Margie for making this possible. She is amazing. I also would like to say, I appreciate you guys as clients. I know it's been a rough year. You know, a year ago, we didn't have the seminar for obvious reasons. And now we're a year later and here we are in kind of a different element, but I'm hopeful, like everybody, that we're going the right direction. And I do want to say I appreciate your support working with us through this last year, which has not been easy. And I just always have to say, you know, as a owner of Elkhorn Vet for 30 some years and now a manager, you know, that this has been, I'm very grateful to the doctors that we have on staff. Everybody's pulled together. It hasn't been easy with masks and all the procedures, but we've really worked hard to keep everybody safe. And our office manager, Margie, has worked hard to keep us on that track, as well as all of our staff. And I'm grateful to our clients because I know there's been frustrations and we could have never gotten through all this without our client support as well. And I won't keep talking, but I just, again, many thanks to you, our clients, and many thanks to our doctors and our amazing staff who's dealt with a lot of challenges like everyone. And I'm not sure, I see another here little comment, so I'm just going to move down. Oh, that's nice. Leslie thanking us for finding a way to get this on the air. And again, thank you for being out there. So I guess if there are no more questions, I will say I look forward to seeing our clients in the flesh and not on a video screen. And hopefully we'll be all together next year and do this the way we all are used to. And again, thanks a lot. And again, thanks to all of our wonderful doctors and staff. All right. We'll see you next week, hopefully. Don't let me forget, this is really important. If you guys enjoyed tonight, it's only going to get better because our younger doctors are actually smarter than me and better at this. And so this is
That's
just
a lie.
so well.
That is not true.
Okay.
No.
Anyway, we're having fun. So I hope you guys did too. Thanks again. And all right, I'm going to say goodbye. Thanks again. All right. Bye-bye.